Welcome to the Innovative Infusion Solutions Orientation. The orientation agenda is as follows. You will learn about Innovative Infusion Solutions, or IIS, our healthcare partners, mandatory human resource compliance, vital company information, our staffing process, utilized paperwork, pumps and products, lab work considerations, if they are ordered, required visit equipment, and expected professional integrity. And lastly, critical communication to incorporate along with key points to remember. We will close with our official IIS welcome and an orientation examination to ensure your competency and retainment of the orientation information provided. Please feel free to write down any questions or clarifications that may arise during this orientation presentation. Contact our office directly during normal business hours and we'll be happy to answer them for you. Innovative Infusion Solutions was founded in December 2009. We are a premier home infusion nurse registry that specializes in recruitment, identifying, and referring exceptionally skilled infusion registered nurses to specialty pharmacies, home health agencies, and infusion centers to provide infusion therapy services for various communities of patients with acute and chronic illnesses in several states within the United States. Innovative Infusion Solutions was established and is managed by a staff that is passionate about optimal infusion therapy experiences. This brings us to the IIS mission. The mission of Innovative Infusion Solutions is to significantly elevate the number of positive therapeutic outcomes and experiences for patients receiving infusion care within the comfort of their home. The IIS vision. Innovative Infusion Solutions strives to be nationally recognized as the leading and preferred home infusion nurse registry supporting specialty pharmacies, home health agencies, and patients requiring infusion care. Innovative Infusion Solutions is a home infusion nurse registry. We refer exemplary skilled infusion nurses to our healthcare partners. We are IV specialists. We are infusion therapy experts. We reach for the highest quality of care at all times, and we always seek optimal patient experiences and outcomes. Evidence of the IIS standards, our Joint Commission accreditation. In February 2014, Innovative Infusion Solutions was certified by the Joint Commission. The Joint Commission certification program provides an independent, comprehensive evaluation of a healthcare registry pool's ability to refer qualified and competent staffing services. Joint Commission accreditation symbolizes cohesiveness and a culture of excellence that is committed to a higher standard of service. This quality-driven framework is recognized and highly valued by insurers and other third parties. Our partners are specialty pharmacies, home health agencies, and medical doctors. Specialty pharmacies receive prescriptions from medical doctors to provide infusion therapy for their patients in their home and are in the specialty pharmacy's ambulatory infusion center. Home health agencies receive prescriptions from medical doctors to provide infusion therapy services for patients within their home. Medical doctors. Some medical doctors prefer routine and first-time dosing at their office. We assist our healthcare partners by referring highly skilled infusion nurses to fulfill their various infusion therapy needs. Human resource compliance is mandatory. Your HR file must be current and up to date with current resume, RN license, CPR and BLS card, driver's license, auto insurance, malpractice, professional liability insurance, current physical examination or medical release. It can't exceed 1 year old. Current TB test or chest x-ray. Your skin test cannot exceed 1 year old and the chest x-ray cannot exceed 2 years old. Immunization card and our MMR vaccine. Titer, our signed declination, varicella vaccine. Titer, our signed declination. Hepatitis B vaccination. Titer, our waiver. If greater than 10 years for Hep B vaccine, you will need to sign a waiver. Flu vaccine, our waiver. Additional HR documents that must be completed, signed, and submitted. Annual TB screening and assessment form. Independent contractor application form. W-9 must include your Social Security or tax ID number and signature. Background consent form. Authorization to release. Patient confidentiality. Reference form. 2 completed references for RN work history. IV examination. Skills checklist. your self-assessment of your nursing skills, orientation checklist, and orientation examination, provided to be completed at the time of your orientation. After submission of all required HR documents and you have an identified completed HR file, non-active, which implies you are not approved to receive infusion referrals, you will then be provided an independent contractor agreement and a business associate agreement. Both will need to be signed and returned to the HR department. At that time, your HR file will be 100% completed and converted to active, which implies you are approved to receive infusion referrals. Remember, overall HR compliance is mandatory to obtain an active RN status. Always ensure items with potential expiration dates are monitored and replaced prior to the date of expiration. Items such as licensures and certifications, malpractice insurance, automobile insurance, IIS clinical skills checklist, annual health assessment, and TB chest x-ray. Annual performance reviews and ongoing updates requirements should be expected. Again, please replace all items approaching expiration dates as expeditiously as possible. Never allow the item to exceed the expiration date without providing the current replacement. In efforts to meet and maintain our Joint Commission accreditation standards, ongoing drug competencies, yearly skills checklists, review, and RN performance evaluations will be required. Note, it is your responsibility to maintain a compliant human resource file minus any outdated, expired items at all times. Vital company information you need to keep in mind are as follows. At the submission of your independent contractor agreement and your business associate agreement, you will be sent electronic copies of the clinician's handbook and policies and procedures manual. You will need to read them and familiarize yourself with our professional and clinical expectations. You will also be mailed your IIS welcome folder that will include your ID badge and stamp envelopes that you will need to mail in your original patient notes after you fax them in. Our office hours of operation are Monday through Friday, 9 a.m. to 6 p.m. Pacific Standard Time. We can be reached after hours for emergencies. For non-clinical emergencies, please call 951-707-9989. Leave a message and your call will be returned in a timely manner. A non-clinical emergency example could be you are scheduled for a Sunday morning infusion visit and you learn the medication delivery never took place after calling the patient on Saturday evening for your final visit confirmation. For clinical emergencies, please contact our on-call clinical supervisor at 213-215-4569. This phone is routinely answered, but if you are required to leave a message, please do so and your call will be returned promptly. An example of a clinical emergency could be a tremendous blood pressure spike during your infusion and you are unsure if you should continue with the infusion. Our reimbursement policy and process. How we reimburse you. We reimburse weekly every Friday. A reimbursement week is Sunday through Saturday. We do offer direct deposit. It is tabulated from your submission of your patient visit notes and the following two documents: a weekly visit invoice and a daily activity record. The weekly visit invoice is your invoice to Innovative. This will provide an itemized list of all your patient visits for the week. The daily activity record accompanies your patient notes and is provided to our healthcare partners. It is your timesheet and it will include your patient's name and signature. Keep in mind, only one patient can sign a timesheet. Never allow two different patients' signatures on the same timesheet. Reimbursements are dispensed every Friday. We do offer direct deposit. Due to your independent contractor status, you will receive a 1099 yearly. Now for the IIS staffing process. The relationship is as follows. The patient's medical doctor writes a prescription. That prescription is provided to the specialty pharmacy of choice. Innovative is contacted for the request for an infusion nurse. Once we have received the referral from one of our healthcare partners, we then contact you via text and email with the provided specifics of the infusion case. We request that all nurses respond as expeditiously as possible so we can respond in a timely manner to our healthcare partners. If your answer is yes, the visit is confirmed. All information required for the visit will be sent to you electronically in a HIPAA-compliant locked file. You must confirm receipt of content of your email within 12 hours of accepting the case. You are also required to contact the patient within 24 hours of accepting the case for the purpose of introduction and confirming visit date, day, and time. Note, cancellations are forbidden and evaluated on a case-by-case situation once you accept a case. Therefore, we urge you to not accept a case if there is the slightest possibility you may have to cancel. Visit documentation process and expectations are as follows. All patient information and required documents for visit and charting are emailed to you. Due to the fact charting documents vary per our various healthcare partners, you can expect to receive specific charting documents associated with every case you accept. After completion of your visit, you are required to fax your patient's notes within 24 hours to 951-710-6699. Please take the time to confirm we have received your fax. After you have confirmed we have your faxed patient notes, you are required to mail the originals to us, utilizing the stamped envelopes we provided to you. Please advise our HR department if you need more stamped envelopes. Please keep in mind, when you are charting, accurate documentation is mandatory. Your charting should always include the patient's history of therapy usage, their tolerance, and a detailed diagnostic specific assessment. No problem assessed, NPA, is not acceptable when charting specific to the system associated with the patient's diagnosis. Your visit can be a start of care or a follow-up visit. Again, the documentation may vary per healthcare partner. Therefore, it will be provided with each accepted case. Please provide a patient welcome guide for any new referral, regardless if the case is a start of care or follow-up. The patient welcome guide clarifies who our registry is and the fact that we are not a home health agency. It also provides our hours of operation and the numbers for reporting questions and our concerns. The various documentation that can be utilized within our registry are as follows: patient system assessment, flow sheet, medication profile, treatment care plan, additional clinical note, MD order, pharmacy supply order, discharge summary, missed visit note, clinical addendum, weekly visit invoice, and the daily activity record. All needed supplies and medication will be sent directly to the patient's home prior to your arrival. You must confirm medication delivery the night prior to your visit. We do not provide car stock. A link for the typical pumps our healthcare partners utilize is on our website and will also be included in your IIS welcome folder. You are required to provide and bring your own blood pressure assessment device, stethoscope, and thermometer with probe covers. The vital sign assessment devices are mandatory for all patient visits, no exceptions. Lab work is not routinely ordered with each visit. However, if it is ordered, you must contact the patient to confirm that lab supplies and the requisition are at their home prior to your arrival. There are two specific routes in which we draw and deliver blood work. One is lab in the box, which includes all items needed to draw labs. Typically, you would need to call FedEx to pick up. So you will have to consider their pickup cutoff when scheduling this visit. FedEx contact number is 800-463-3339. The home healthcare laboratory number is 888-522-4452. And the link is www.hhla.com. The second would be to drop off blood work to the requested laboratory. All items to draw ordered labs would be delivered to patient's home, and our office would have to identify where our healthcare partners want the lab work taken. We would assist in coordinating the closest drop-off to the patient's home. Please keep specimen cool and from direct sun exposure. Consider the lab hours of operation if they close for lunch. You must provide and bring your own blood pressure assessment device, stethoscope, and thermometer with probe covers to every patient visit. The vital sign assessment devices are mandatory for all patient visits. No exceptions. If your blood pressure device is battery operated, please have extra batteries on hand. Note, you must have a pediatric blood pressure assessment device, cuff, if you are servicing pediatric patients. You are not allowed to improvise with an adult blood pressure assessment device. Our acceptable dress code is scrubs or business casual. However, please assess if your patient is okay with you wearing scrubs to their visit. Some patients prefer neighbors not see their nurse in scrubs. Along with your vital sign assessment devices, always have on hand all documents sent to you for charting purposes. HIPAA compliance is mandatory. The Health Insurance Portability and Accountability Act demands that all HIPAA-covered businesses prevent unauthorized access to protected health information, or PHI. PHI includes patient names, addresses, and all information pertaining to the patient's health and payment records. All patient information is sent to you electronically via a HIPAA-compliant share file system. You are expected to fax in your notes. You must utilize your own private fax machine. Public faxing is never an option and it is forbidden. Examples of public faxing sources include, but not limited to, the following: Kinko's, FedEx, Staples, UPS, etc. Note, it is your responsibility to protect patient information. At the time you accept your case, you must contact your patient within 24 hours. At that time, you will introduce yourself, confirm visit address, date, day, and time. You will identify if there are any unique circumstances or instructions, such as parking, etc. The night before your scheduled visit, you will contact the patient to confirm delivery of supplies and medication. If delivery has not taken place, please contact us immediately for further instructions. If it is after hours, call 951-707-9989. While at your patient visit, if a clinical complication arises, please contact the clinical supervisor at 213-215-4569. If a severe adverse reaction occurs, first follow anaphylaxis protocol per our healthcare partners' guidelines, and then contact our clinical supervisor with report. Keep in mind that every pharmacy functions differently and may not want MD contacted directly due to standing orders in place to treat typical side effects. So please contact our clinical supervisor on call for further instructions, should this type of situation arise. The following are an itemized list of key points you must always remember. After accepting a case, check email within 12 hours to confirm visit information. You must contact your patient within 24 hours of accepting the case. You must contact your patient to ensure medication and supply delivery the night prior to your scheduled visit. Always appear to your patient, visit promptly and professionally with vital sign assessment devices and required charting documentation. Always complete a full systems assessment and document accurately, legibly, and diagnosis specific. Never spike medication before securing venous access. Never leave patient's presence when connected to therapy. Always follow orders and protocol. Fax notes within 24 hours following your visit to 951-710-6699. Mail original visit notes within 48 hours after confirming fax was received. You must speak verbally to staff to cancel a scheduled visit. We thank you for completing the Innovative Infusion Solutions orientation. We look forward to addressing any questions and our clarifications identified throughout our orientation presentation. Contact us directly at 951-707-9989 during our normal business hours. Those hours are from 9 a.m. to 6 p.m. Pacific Standard Time, Monday through Friday. Following the orientation, you will need to complete the orientation examination and orientation checklist and submit them both to our Human Resource Department. And finally, welcome to the IIS team. We welcome you and thank you for joining the Innovative Infusion Solutions team. Please keep in mind, you are joining an elite culture and a thriving community of exemplary skilled infusion nurses dedicated to infusion excellence and the highest standard of patient care. Welcome aboard.